Hello and welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in this episode, we discuss penile implants. Most guys are aware of the common treatments for erectile dysfunction, ranging from pills to injections to vacuum pumps. But what if those treatments don't work or have intolerable side effects? Did you know that erectile dysfunction can also be treated by surgically implanting devices into the penis that can create erections on demand? So what is involved with this type of surgery? Are these implants safe? How do they work? What are the risks? And are they durable enough to last for the long haul? To help us answer these questions, we are fortunate to be joined by Dr. Marah Hehemann. Dr. Hehemann is a board-certified urologist specializing in male reproductive and sexual health. She earned her medical degree from Rush Medical College and then completed her general and urologic surgical training at Loyola University Medical Center, and then completed a fellowship in Andrology, male reproductive and sexual health at the University of Washington. Dr. Hehemann is an active member of several national and international societies, including the Sexual Medicine Society of North America and the Society for the Study of Male Reproductive Health. And she serves on the editorial board of the video Journal of Prosthetic Urology. And now, without further ado, I bring you a conversation with Dr. Marah Hehemann about penile implants. Hello, and welcome to Better Man Clinics. Today, we're going to be talking about penile prostheses. Now, most guys have heard about some treatments for erectile dysfunction, Viagra, Cialis, sometimes even more complicated treatments like penile injections or vacuum erection devices. But what if those don't work? What options are available for men that really have run out of options? Well, one really great option that often isn't heard about is penile prosthesis, or actual surgical implants that can help with erections. But with those come a lot of their own questions, such as what's involved? What's that surgery really like? What are the risks? Does sex feel any different? And is this something that I can use the rest of my life, or do I have to trade it in 5 years? Fortunately, to help us answer these questions, we're joined by a true expert, Dr. Marah Hehemann, who is an assistant professor of urology at the University of Washington and an expert on penile prosthesis. Dr. Hehemann, welcome to the program.
Good morning. Thank you so much for having me. Appreciate it.
It's our pleasure. I know I've gotten a lot of requests from our listeners and viewers about this topic that really want to understand penile prosthesis better. Now, before we jump into the topic, one thing I'd like to do at the beginning of the program is just to learn a little bit more about our expert, to also make the guys more comfortable with who's presenting this information. So one question I have for you is that what led you to this journey? What interested you in male sexual health and specifically in penile prostheses?
Sure. So I actually started my journey into urology and into men's health very earlier than most of my colleagues. I was an undergrad, so after freshman year of college, I got a job with a family friend working in a urology clinic. And this gentleman, who was a urologist in Chicago, very well known in the field of prosthetics and in male sexual health, I started working as his administrative assistant, doing his academic work of, making his presentations for academic meetings. And so I got a really great view into the world of academic male sexual urology. And it sort of paved the path before I even went to medical school. So always been interested in it, always been interested in having these conversations about how to improve quality of life. And then, of course, wanted to be a surgeon. So it all sort of fit together.
Amazing how much a mentor can guide your path, right? And in a path that you may not have expected when you were super young, but like it's just that mentor makes such a big difference. It's a great story, and I know it adds to the passion that you have for everything that you do as well. Thank you for that. You know, as we dive into penile prosthesis, I think it's important to lay down some definitions, right? So let's start off with a simple question. What exactly is a penile prosthesis? Most guys talk about robo-penis, bionic penis, which is all funny and all fun and games, but what is a penile prosthesis?
So penile prosthesis is a surgical implant at the core, just like a breast implant or a knee implant that you get when that body part is not functioning optimally. So when your knee has arthritis and you can't do your daily functions, you might get a knee replacement. I like to think of a penile implant just like that. It allows you to get back that part of your life and that part of your quality of life through a surgical implant. There are a few different kinds, a few different brands that, companies that make them. And globally, they are different. So the implants that we have here in the United States may not be used in Israel, for instance. That's just due to device approvals. But largely, they're all still surgical implants that allow a man to have an erection again, where prior to surgery, he may not have been able to have one.
Now, aside from the different brands, I understand there are different types of penile implants that guys ask a lot about. Can you talk a little bit about the different types?
Sure. So when I talk about penile prosthesis, I break it down into sort of a decision tree, if you will. The largest difference between the different types of implants is that there are the semi-rigid type, which are otherwise known as malleable implants. They're sort of loosely referred to as rods, if you will. So these are really high-tech rods these days. They are bendable, so they're semi-rigid, but they do bend up and bend down. And so they're very easy to use. They allow a man to have an erection that he just bends up in the time of need and then bends back down when no longer needed. So those are the semi-rigid. The other type in the sort of decision tree is the inflatable penile prosthesis. And in that category, there are actually two different types. One is a two-piece, which just refers to cylinders. So these are the erectile cylinders that will give the erection, and a small pump in the scrotum. And then a three-piece refers to an inflatable implant that works with three different components: cylinders, a pump, and a reservoir. So those are more of what I would consider the hydraulic tools that we use to give a guy a penile implant. Those are sort of the gold standard in the United States.
Got it. And so just for clarification for all the guys listening at home, for the semi-rigid, you're always rigid to some extent, but you can bend it down. So obviously you're not walking around with an erection all day. But for the inflatable, the penis is just like naturally, it's completely basically flaccid, right? Until you pump it up and get an erection. Is that correct?
That's exactly right. It's important for guys to know that these implants have been around since the 1970s. So they have have an amazing track record of approval and use for 50 years now. And what has taken place during that time is sort of an evolution. So making the devices safer, better, last longer. And when it comes to the semi-rigid, more concealable when placed in the downward position. And when it comes to the inflatable devices, very natural appearing when they're not in use, like you mentioned. Exactly.
Got it. So one thing we've all learned is that there's no free lunch, right? Everything has advantages and disadvantages. If you take your first part of the decision tree, inflatable versus semi-rigid, can you share with us, like, what are the advantages and disadvantages of each that you come across with patients?
The major advantages to the inflatable device and why it's used as sort of the gold standard here in the United States is that it is the most physiologic or natural or way to get an erection again. So it simulates sort of the, hydraulic mechanism that is an erection for guys. When when a man has an erection, it's strong blood flow into the penis. It gets trapped, the penis gets hard until the blood flow is released. And that's essentially what the inflatable device is doing. So an inflatable implant is just fluid moving in a hydraulic system to give out good erection. It's supernatural in both the flaccid and erect states. So that's why it's used most commonly in the United States. The downside is that it does require some hand function to pump it up. And so for men with really poor hand function, it may be preferable to use a semi-rigid. The rigidity of the inflatable is really excellent. So good hard erection. And that is one of the disadvantages of the semi-rigid, is it may not have the same rigidity for sex. But it's better for guys who may not have as strong of hand function.
Got it. And I'm just going to jump into a little nuance there. When you say pump it up, what are they pumping? Are they pumping the penis? What are they pumping exactly to get that erection for an inflatable prosthesis?
Yeah, thanks so much for clarifying. So in the inflatable implant, there is a pump. So this is all, a lot of guys ask, is part of this going to be outside of me? And the first thing I, go over is that everything is contained inside. And when the implant is deflated, no one would ever know that you had this in. So all of the parts of the implant are put in through a very minimally invasive surgery through a single small opening, typically on the scrotum or above the penis, depending on your surgeon. And there are, like I mentioned, 3 parts. The first is the reservoir that holds the fluid that moves through. And guys don't really interact with that when you have the implant put in. So it's sort of tucked away, and you don't really feel it or see it or interact with it at all. The 2 parts that a man will interact with are the cylinders, which are the parts that go in a man's natural erectile chambers. So every man, to get an erection, the penis has 2 chambers that fill with blood. And these are cylinders that are taking the space and are being placed directly into that area. The third part is the pump, and this is placed into the scrotum. And so to pump it up, it is accessing this tiny pump inside the scrotum to inflate, just like back in the 90s, we had Reebok sneakers that were the pump up sneakers.
Yeah,
it's similar to that.
Nice. But so it's basically kind of like a small third testicle that you're kind of squeezing. So you just got to make sure that they don't squeeze their actual testicles. That would not be pleasant, I'm sure, to give them an unpleasant surprise.
Yeah, usually guys don't make that mistake, but
anything can happen, I guess, right? So the next natural question, you said that the inflatable prosthesis looks natural, right? And it kind of, the mechanism is natural. The next question that most guys will ask, well, but does it feel natural? So whether you have an inflatable prosthesis or a semi-rigid, the main thing guys wants to know is, does sex feel the same?
So that is a challenging question to answer. And one really amazing benefit, I'll kind of go over the exact answers that I've heard from my patients. But one great benefit is if a guy's considering getting one of these implants put in, there are other guys throughout the United States who have them and who are willing to kind of give their take. So these are called our patient advocates, and they can, these are people these are men who've experienced what it's like to have sex with an implant, and they're willing to talk one-on-one. So, if you are considering an implant, have your surgeon give you the name of these advocates. These are guys around the country who will tell you what they think, and they'll be super honest about it. So from my standpoint, what I understand, the really amazing benefit to these implants is it doesn't change the sensation of the skin and of having sex, but it does give back the rigidity. So the nerves to the penis in terms of sensation should not be changed at all. There are reasons for men to have ED that may also change those sensation nerves, like diabetes, but it should not change from pre-surgery. What is slightly different is the feeling of the head of the penis. So that can be different after an implant. And the reason why is because the head of the penis, or the glands of the penis, it's not made of the same spongy tissue as those erectile cylinders. And so the head of the penis itself may not get as totally rigid as it would with an erection when a guy is 20 years old. So that's one difference that is talked about, is just that the head of the penis may feel a little less hard, a little more cold. And, it's rare that I hear those kind of negative things, to be honest, but it is one potential disadvantage.
But they are feeling, obviously, their penis, that still feels, sex still feels like sex. I'm assuming that you may hear that the erection doesn't feel exactly the same way, right? Because the blood is not going in there, but you're still enjoying the sensations of sex. Basically.
Exactly. That's exactly
and then,
right.
And is there any impact on achieving an orgasm or climax, or on ejaculation? Is that impacted at all?
No, not by the implants. So it won't change where a guy's at. Again, just important in terms of expectations of what the implant will do. There are, the reason why guys get ED can be things like diabetes, vascular disease, after a prostate cancer treatment. And so those things may impact a guy's ability to get an orgasm or ejaculation, and specifically in the case of prostate cancer treatment. If a guy has had that treatment, he probably won't ejaculate anymore. And so those things may change it, but the implant will not change where he's at in terms of orgasm or ejaculation.
And another question that I hear frequently is that, especially for the semi-rigid, right? So like with the inflatable, everything normally, when it's not inflated, it's all flaccid, everything feels normal. With the semi-rigid, you still have those rods in there that are kind of right around the area where you pee through, the urethra. A lot of guys already have problems with their prostate and trouble urinating. And the concern might be, well, is this going to make it any more difficult for me to urinate because those rods are in there?
The answer is no. So the cylinders that create, where our implants go are distinct or separate from the urine tube. And so it should not change your urinary function.
Perfect. Now, another thing you just mentioned was, and which is a great segue, was expectations. Right. So guys hear robo-penis and they say, well, if we're going to have a bionic penis, we might as well spruce things up a little bit. Right. And the thought is that, okay, if you're going to put in a prosthesis, I want an extra large. So because the idea is, can this prosthesis actually increase the length or girth of the penis? Now, I don't mean by giving you an erection, obviously. I mean more in terms of from the standpoint of just actually, can you make the penis any larger because of the presence of the prosthesis?
Great question. Super glad you asked, because that definitely comes up all the time. And I like to make these, I like to make the expectations known ahead of time. The implant cannot make a guy any longer. And anybody who is telling you that they're going to make the penis much larger or longer is, maybe trying to sell something to you. So no, penile implants overall cannot make the penis longer. The answer is very simple. Can it give a guy back the rigidity and girth of having a full erect penis? Yes, but it will not make you longer or wider. There are some strategies that I talk with my patients about how to get the optimal result when I do surgery, sort of penile rehab before an implant that may help with length, but the implant itself cannot help with length.
And that's so important, because I mean, you have to have the right expectations going in, right? That's the main thing for sure. Mark, can you hold on for one quick second? I apologize. Sure. Hold on one quick second. I apologize. Rugrat invasion.
No worries.
Perfect. So we talked about the girth and length of penis. I want to switch gears a little bit and talk about candidates, right? Like in terms of who the ideal candidate for a prosthesis is. In the introduction, I mentioned, most guys are familiar with the usual, Viagra, Cialis, even like, injections or vacuum devices. Is a penile prosthesis ever the first choice before you do that? Or how does that usually work in terms of the, if you will, the algorithm for erectile dysfunction?
So it is my strong feeling, and under the guidelines of the American Urological Association, which is sort of our governing body of urologists here in the United States, that you do not need to fail the other therapies to be a candidate for the implant. If a guy has a reason for ED and he wants to have an implant because it makes the most sense in terms of, and I'll kind of go over some of the reasons, then he can get that before doing things like, using pills for 6 months, or you must try injections. That's not really the case. I put it on the table for everyone. So anyone who's a good surgical candidate who can undergo a 1-hour, really minimally invasive surgery can be a candidate for an implant. Yeah, and so, some of the reason why I say that it should be on the table for everyone is because it's really the only technique we have to restore erections for guys who want spontaneity with their partner. So want an on-demand erection without having to deal with the rigmarole of taking a pill or using a vacuum device. It gives men back that spontaneity for an on-demand erection.
No, that's such a good point, actually, because that's true. All the other options, really, there's some luck involved. There's some time involved. There's a lot of things up in the air versus this, which is substantially more reliable and instantaneous, basically, in that
Exactly.
sense. And I think that's important for guys to know, because I think the word on the street is, or the common perception is, it is the option of last resort, versus sometimes maybe guys want to use it as a first resort, and there's nothing wrong with that potentially. Absolutely. Now, with that being said, I apologize. With that being said, are there any guys for which this should never be a resort? Is there any guys that really should consider not getting a prosthesis, who are like, for which a prosthesis might be a contraindication, for instance?
There are, I do watch out for young guys who may have ED related to around performance anxiety or other life stressors, which, I always want to make it clear that the common thought that this is all in your head, that's not really true, because things like stress and anxiety are part of your body, and they create a physiological response that can worsen erections. In order to get a good erection, men have to be relaxed. It's just a part of the physiology. So guys who have ED related to potentially frustration or anxiety around things, I would want them to kind of work through some of that before, just because this is an irreversible surgery. And so, it's still on the table for those guys, but I think that there are other potential strategies for them. The other is men who think, who have the incorrect assumption that this is going to make them longer or girthier. I want to just make sure we're all on the same page before I go forward with surgery. Yeah.
Yeah, that could be a pretty big disappointment for sure. You don't want them to be unhappy afterwards. Now, one thing you mentioned that I want to unpack a little bit is that it's irreversible. So one of the things, obviously, if you take Viagra and it doesn't work, okay, it didn't work. No harm done usually, right? What happens if you have a prosthesis placed? Let's say it works or doesn't work, but then eventually you have it removed. What are your options for managing erectile dysfunction afterwards? Can you go back to those other treatments? Can you go back to Viagra or injections or anything like that? Or is just the only other option another prosthesis in that situation?
Yeah, so once a man has an implant put in, he cannot go back to the other options. So that's incredibly important to know, and thank you so much for educating the guys listening. It is a, an incredible treatment that is the kind of final amazing solution, but it is not reversible. So if an implant is put in and it needs to be revised or, replaced, and I'll kind of, I'm sure you have a question about the lifespan of these implants. If it needs to be removed and replaced, my guidance is to not let any surgeon take it out without putting one directly back in. And that's, the guidance that men should go forward with if they have an implant in.
Got it. So, I really want to dive deep now because, one of the things that guys really want to know, they want to know the nitty gritty, if you will, of the actual procedure and kind of what they're getting into. So let's pretend I'm your patient, Dr. Hehemann. I got a consultation and I have some questions for you, right? I've done my homework. I've watched Better Man Clinic's podcast. Now I have some questions for you. The first one is, okay, this sounds really good. Both prostheses sound really good. It sounds like right what I'm looking for. But what are the real risks at the time of surgery? What can happen? What can go wrong potentially when we're having the surgery itself?
So in experienced hands, someone who does a lot of these procedures annually, it is a very safe surgery, but there are some areas where things can go wrong for any of us. And if this, if something has gone, if one of these things has happened to you during surgery, it is not that your surgeon did something wrong. These are just things that can occur during even in the most experienced of hands. Mm-hmm. So first things first is just the structures we're working around, things like the urethra, your P tube, the bladder, and down in the pelvis. Those things can be injured during surgery. That is very low risk, and we're always very safe about putting these in and keeping those really important structures safe. But that is something that can occur. The other thing that can occur during surgery is misplacement of some of the components of the implant. Specifically, we get into the question of getting the implant exactly in those erectile chambers. So in guys who have had scar tissue of the penis, we may accidentally cross over, meaning putting the cylinder from the right side into the left side. There are ways that this can be corrected, especially in very experienced hands. Also experienced surgeons in this area would know when to stop and when to come back to sort of fight another day and get the implant in a safe way. So those are at the time of surgery, those are sort of the worst case scenario, extremely rare circumstances. Usually this is as I mentioned, about a 1 hour surgery. I perform this as an outpatient surgery for most men, and it's very safe.
So it's outpatient, so they can go home the same day, which is great. Does it require general anesthesia?
It does in my hands and in most implanters. So in the majority of surgeons who do this procedure in the United States, the patient is put to sleep. It takes anywhere from an hour to hour and a half, typically, sometimes shorter. And most surgeons let guys go home either the same day or just the morning after surgery.
Got it. And is there any preparation that I would need to get before surgery, like to get ready for it?
In terms of preparation for surgery, most surgeons would want their patients to do things like using an antibacterial soap wash that they would instruct you on for either a week before surgery or a few days before. It kind of depends surgeon to surgeon, doctor to doctor, but usually that's kind of the main preparation. Doctors typically like to, we have to remove the pubic hair just to kind of get a clear field to do our implant. And we like to do that ourselves. It's been shown to be safer and reduce infection when we do it ourselves. So most docs I know would prefer to do that ourselves. Some have a guy do it at home. So those would be in your instructions. And If you're signing up for an implant, that should be something that your surgeon would talk to, or their staff would talk to you about.
Got it. And you alluded to this before in answer to some other questions, but I just want to kind of make sure we put it on the table. And just in terms of on a high level, what's happening during surgery? You mentioned that you make a little incision, either like around the scrotum or just above the penis. And I think you mentioned that people wouldn't be able to really tell you had surgery, right? Based on those incisions. Is that correct?
Yeah, absolutely. So those are the two main approaches, the two main ways we do the surgery. And either way it goes, you would never know that you had a scar there. They're very well concealed cosmetic procedures. So that, that small opening is made. The next step is measuring the inside of the erectile body. So those cylinders where we are going to place the implant, we measure that, and we need to choose a device. So choose the implant that is going to give the guy the most length and the most rigidity. And so there are some sort of game time decisions that need to be made. We don't pick your size beforehand because we need to measure the penis from the inside. And the penis in men goes out of the body, and it actually goes back inside the body too. And so that measurement that we get when we're in the operating room is used to choose the length of the implant. So we can't pick beforehand. That's measured, and then we place the reservoir, the cylinders, and the pump. And then the implant is connected so the fluid can move through, and then it's closed up. That's really kind of the surgery in a nutshell.
Got it. And so that's for the inflatable, and again, just for the guys at home. So the reservoir is just kind of like this ball of water or fluid that is, when you're not erect, it just kind of stores it, right? And then the pump is actually just that, as you said, like in those Reebok pump shoes, it actually you're pumping the water from that little reservoir into those cylinders in the penis to give you an erection. And then when you're done, you push a button and the fluid goes back in the reservoir. Does that sound about right? Perfect.
Yeah, so exactly. It's just movement, and the fluid inside is sterile saline, so it's salt water, very safe. If it ever were to leak out, it is extremely safe, totally not harmful at all.
Got it. Now, you mentioned that, okay, it's great. They can go home the same day. Sounds fantastic so far. But when they're home, what kind of pain do they expect immediately after surgery?
So we have, in our field, we've tried to get away, and most surgeons are working without any use of narcotics or very little use of narcotics. And so we have sort of developed ways to get around having lots of pain after surgery and needing those strong pain medicines by giving other types of medications either before the surgery or during the surgery. I do tell patients that every guy's different. So there's no way that I could tell whether you are going to have, pain for 2 weeks or you're going to have just mild discomfort for 2 weeks. It's hard for me to know that for sure, but it is a surgical procedure. So having some discomfort is expected. For the first 2 weeks, I would say you may have some discomfort, and a guy may be kind of walking around a little more gingerly for the first couple weeks. But many patients, don't even require those kind of strong pain medications like the narcotic type of pain medications. So it's been real progress that we've made trying to make sure that these procedures are done less painfully and without the use of those medications.
Fantastic. No, that sounds pretty good. Now, do most guys go back to work? Is it about 2 weeks off, or they go back to work sooner? What has been your experience in terms of returning to work after the procedure?
It depends entirely on what a guy does for work. If you are working from home behind a desk, I would say maybe take a couple days off, just to be comfortable, so you're not having to be on, and so you can recuperate. But if you were to be doing more kind of hands-on labor, front lines type of stuff, you probably would want to take about 2 weeks off.
Got it. And so you brought up the analogy of a knee replacement. And so after a knee replacement, oftentimes there's a lot of physical therapy that needs to be done. You have to rehab the knee, kind of get it back into shape before you're out there kind of doing a lot of sports and stuff. Is it the same thing with the prosthesis? Meaning, is there some type of rehab that needs to occur before guys can resume sexual activity? And to that same extent, when can they resume sexual activity?
I love this question. I do think that there is some, anytime we do surgery or an implant, there is sort of a time when the patient has to have their own skin in the game. And that does exist for penile implant as well. As I mentioned, each surgeon who does the surgery may have different sort of nuanced, specific instructions. But there is just a little bit of rehab that goes on. Things like learning how to feel for the pump inside the scrotum. Things like learning how to press the pump button. And your surgeon or their staff will kind of walk you through at what point you should be expected to do that and how to do it. That's one of our goals, is to make sure everyone's super comfortable with things. But directly after surgery, in terms of rehab, the main thing that we want to do is make sure that pump down in the scrotum is well positioned. And so most surgeons will want you to do just very gentle exercises of kind of bringing that pump down. That's the crux of the rehab after the surgery. A few weeks after surgery, the surgeon may want you to start inflating and deflating, just sort of doing gentle exercises like that. And then at about, usually between, in some surgeons' hands, 3 weeks, in some 4 weeks, in some 6 weeks, that's when you're good to go for use for sex.
Got it. So you're not leaving the operating room and proceeding with sexual activity. I think that's an important expectation that we need to.
No, there is a healing period. And for a lot of guys who end up with an implant, they've been having, challenges with ED for some time. And so hopefully that 4 weeks won't feel too long. I think it's actually a pretty rapid recovery. So there's a little bit of a waiting period afterwards.
Got it. And so you outlined pretty clearly the risks of the procedure in the operating room, but obviously, there's also long-term, right? So I'm recovered, I'm feeling good, I'm starting to use the prosthesis, I'm having sex with it or whatnot. What type of complications or long-term issues do guys sometimes experience with these type of prosthetic implants?
Yeah. So there are 2 complications that are sort of innate to any type of implant that we put in the body, whether it's a knee, as I mentioned, a breast, as I mentioned, or the penile implant. One is that it's a foreign body and it can become infected. As I also mentioned, as these implants have evolved, the risk of infection has come down because of some amazing technology that has been adopted by the manufacturers. So they have adopted ways to get antibiotics absorbed onto the device, or ways to reduce infection. In general, most high volume implanters, meaning people like myself who do a lot of these every year, infection rate is about 1%, so very low. If the implant were to become infected, it may mean taking it out and putting a new one back in. It may mean IV antibiotics. That's one major thing that can happen. The second that is inherent to any implant is that it can undergo kind of mechanical dysfunction or mechanical failure. The risk of that in the short term, in the first 5 years, is extremely low. So there was a study that came out in 2019 that showed that the vast majority, 2/3 to 3/4 of these inflatable implants last over 10 years. So that's a really fantastic lifespan. The semi-rigid devices shouldn't have any mechanical dysfunction because they don't have the same fluid mechanisms. When an implant breaks down, a lot of guys ask me, so am I going to be stuck in the erect position if the implant breaks down? And it's the opposite. So no worries about, you know, being stuck in that kind of precarious situation. It's usually the fluid is leaking out, and so what you'll notice is just that the implant stops working. And it's not it's not an emergency, but you will need, you know, a surgeon to take a look and probably switch either one part out or the whole thing, depending on how old it is.
And so generally that's the solution, right? If something malfunctions or infection or anything like that, generally the answer is a swap out of one prosthesis for another, right? It's not like you're kind of done. You know, you've got a lifespan of, let's say you said 10 years, and then after that, we don't have any other options. Most of the time, they'll just switch out the prosthesis to another one for you.
Exactly. Yep.
Is it, and I just wanted to double click on one other thing you said. You said that for the malleable, it doesn't have those parts. So am I to assume then that it has a longer lifespan than the inflatable? And if so, how long would a malleable last potentially? The semi-rigid.
Yeah, so the semi-rigid or the malleable, those have an amazing lifespan that can be decades, honestly. There are some other challenges with the malleable, and the one primary challenge that's a little bit different is just that this is sort of a rigid structure inside you, and there are, in certain folks, it may want to come out. So erosion of the implant out through the skin is the one sort of unique possibility for a semi-rigid over time that's not really as present in the inflatable. It can happen in the inflatable, but more commonly we see that in the semi-rigid.
And can that be fixed through a swap out too, or is that like one of the once it's eroded, it's kind of done?
Yeah, it can be swapped out, and there are strategies that implanters can use to make that really safe as well.
Now, we talked a lot about the what and the how. I want to talk a little bit about the who, and by the who I mean not the patient but the surgeon. Do most or all urologists do this type of surgery, or is this something that should really be in the hands of an expert like yourself?
I have feelings about that question, but I'm just gonna kind of go to the data. The data shows that the best outcomes in terms of lowest risk of infection, best satisfaction, best safety profile usually comes from surgeons who do a lot of these implants. And that's the same for really any procedure.
Right.
So yes, I do think that when you're talking about getting an implant, the safest approach is to find someone who is an expert and who has expert training in these implants and who does a lot of them.
Got it. So a guy goes to a urologist, it's like when a horse walks into a bar. A guy goes to a urologist looking for a penile prosthesis. What questions should a guy be asking that urologist to, if you will, vet that urologist, say, you know what, is this the right surgeon to be doing my prosthesis? What specific questions would you recommend they could ask, or are there specific questions they should be asking?
Yeah, I think some of the questions are, do you have training in this, or how many do you typically do per year? Most urologists are going to be honest people and want the best care for their patients. So should be honest about those type of questions. There are some online resources to show men who are sort of the vetted implanters. So these are, our device companies have websites that show, doctors in the region who are sort of their centers of excellence or folks who do a lot. And those are the people that are going to show up on the device manufacturers' websites.
So the device manufacturer website is a good resource. I think we'll get that from you and put it on the page so that the guys can be able to access it. And you said high volume implanters. So give us an example or an idea of what's high volume mean? What's an acceptable volume? Is it 50 cases? Is it 3 cases? What's acceptable, I guess, or advisable?
Yeah. So some, there's, in terms of implants, there's no, I don't want to give a specific sort of cutoff. I think that anyone who's doing more than, 20 implants a year, or has the training, you know, in many implants per year, someone would be considered high volume. There are surgeons out there who are doing many hundreds of these a year, and they're fantastic surgeons at it. Does that mean you need to go fly down, you know, to the East Coast if you're on the West Coast? No, there are people who are more than, you know, well trained in your region. And, you know, you just have to sort of use those resources to find the best person. It's also important to feel really comfortable with your surgeon, and make sure that you have a good relationship where you trust them. You have a good understanding of what to expect from your conversations with them. You know, that's a big part of this too. It's a big thing that you're contemplating, and you want to be really feeling comfortable with the person who's going to do your surgery.
Thank you. I think that's great advice. And Dr. Hehemann, thank you so much for all of the insights and input that you provided. I think this has been a wealth of information for all the guys listening out there who feel a lot more comfortable at least addressing the problem. Before we let you go, I want to ask you a question completely unrelated to penile prosthetics or urology, or I think urology in general. You know, we call this podcast Better Man Clinic. It's not just about urological or sexual issues, just about living your best life. And all the experts we have on the program have reached a certain level of success in their lives already. And I always like to ask, what's the secret to your success? What's the secret to living your best life?
I think it's trying to balance what makes you happy. You know, first, I think finding a career that makes you happy. And luckily, I found this, as I mentioned, very early on in my life. It is something that I enjoy doing. I enjoy talking with patients, talking with folks like yourself about my work. And so that's awesome. The other aspect is just, you know, the things that I do for my quality of life, things like exercise, spending time with my family and significant other, all the joys of life that are really important and need to be balanced with a busy career. So, and the Pacific Northwest weather.
Always, right?
Not great right now, but in the summer it's phenomenal. So
can be. No, great advice. Work-life balance is so important for sure, and finding that happy place. Dr. Hehemann, thank you so much for joining us and for your insights. And for the guys listening out there, thank you as well. And remember our mantra here at Better Man Clinics: your best life is a journey and not a destination. And remember to allow every day to get just a little bit better. Thank you, and we'll see you next time.
Thank you.